All right, now we'll assume that we have a plan and we want to talk about how to make the most of it. And for that, we're going to turn to Wells Wilkinson, senior staff attorney at Health Law Advocates in Boston. It's a nonprofit public interest law firm that provides free legal representation to help low-income residents in Massachusetts access healthcare coverage or services. Wells represents clients seeking commercial insurance coverage for needed care, and he has successfully appealed denials of a wide range of treatments, from expensive pharmaceuticals to ABA therapy for autism. Wells also advocates for stronger mental health parity rights and access to needed behavioral health services. Wells, I'm thrilled that you're here. I know you have a ton of experience and expertise, and we are very fortunate to have you with us.
Okay, my pleasure, Susan. Thank you. So I would like to talk today about consumers' rights under their health plans and how they can use them to make the most of their health plan coverage. It's important for consumers to know where to find their rights and to know how to assert them effectively if they ever face a denial of coverage from their health plan. The first source of these rights is the health plan contract, which is usually about a 100-page long document. It can be called a benefit handbook or certificate of coverage or an evidence of coverage. It's this long document that lists all the services that are covered and all the services or treatments that may be excluded under the plan. And if you get a denial, you should always review your benefit handbook to see what it says about that specific service and whether it's covered or excluded. The next source of important rights for health plans is actually either state or federal law. Some plans are subject to both state and federal law and all the guarantees that they have to require health plans to cover certain medical treatments or services, and other plans are only subject to federal law. And even if your benefit handbook says something that is not covered, if it conflicts with either state or federal law that apply, then the law trumps. So I'd like to say a few words about consumers using the appeal process. I work with clients every day to help them do this, and we found the most efficient and most effective way to challenge a health plan denial. But to be successful, you really need to do three things. First, you should read every denial notice from the plan carefully and make sure you pursue all of your appeals until the end. Even if you simply resubmit the same information each time, it's important to know that each level of the appeal process is decided by different people. And many people, because of this, win their appeals kind of later on, even if they're denied initially. In fact, the last step of the appeal process is called an external review appeal. And it is often the fairest opportunity because it's decided by a medical professional who is not an employee of the health plan. The second piece of important advice about the appeal process is to not miss any deadlines during each step in the appeal process. Each denial letter should very clearly state the deadline for the next step in the process. If the letters are confusing or misleading about the deadlines in any way, my first advice would be to call the plan's appeals department and see if you can get a clear answer from them. If issues remain, you can also resort to calling either the State Division of Insurance or the U.S. Department of Labor to ask them for assistance understanding if you have a deadline or what the deadline would be. And the third thing to remember, it's probably the most important, is that these appeals are very often decided based on medical information that you submit in support of your appeal. Even if you file your appeal by phone with the plan, which you're allowed to do, you always have the right to follow up that phone call and that appeal request with the prompt submission of your medical records, and or a letter from your treating provider that explains why the treatment or service is necessary for you. You should definitely include medical records and letters of support from your providers with every appeal, and you should never assume that the plan has any information from your client's providers. I always submit what I think is important, and I resubmit it at every level of the appeal because I just don't trust the health plans to make sure they include that information internally. And if I get any new information, like a new letter from a provider or some new medical records, you always have the right to add that additional information at the next level of the appeal process. So the first step of asserting your rights under your health plan is to understand when you're facing a denial. A denial can be any decision by the health plan that refuses to cover a certain treatment or that results in you having to pay for treatment, such as a decision around your cost sharing or your deductible. The health plans must all provide written documentation of their decisions about coverage. And oftentimes these take the form of the letters that you receive that are called an explanation of benefits, or EOB. This is the letter you receive from the health plan that typically says the words, "This is not a bill." And if you read through that document, which we advise our clients to do, all the time, it will actually provide a reason for any instance when the plan has decided not to cover a particular treatment or service. And you have to read that closely to see what that reason is. More importantly, when you receive this explanation of benefits, that starts the clock on your first deadline to file an appeal. You have 180 days from the day you receive any notice from your health plan that denies coverage for a service to file your first level of appeal. And if you miss that deadline, unfortunately, then you can lose all your access to the appeal process afterwards. So next I'd like to talk about what a patient or a caregiver can do if someone needs a certain treatment and a provider that they want is not covered under their plan. The first kind of general rule of most HMO or health maintenance organization style health plans is that you're only covered when you use their in-network providers. But you can get an exception and you can get approval to see an out-of-network provider when you can show that there's no adequate in-network provider that's available to you. Now, some private health plans have this as a right under state law, but almost all health plans have this as a right under the benefit contract itself, if they have a limited network of providers. So regardless of where you get this right, the most important thing you need to know is that you need to document how you've shown that there are no available in-network providers. So the best way to do this is usually by contacting the plan, asking them for assistance identifying any available in-network providers, and then as you contact these providers to see if they're available to take you as a patient and they're qualified to treat the condition that you seek treatment for, keeping very detailed notes about each one of those phone calls to show or how you can rule each one of these providers out, either because they made you wait too long or they just weren't able to provide the specialized treatment that you need. One example I'd like to share from one of my clients. I had a 7-year-old client with a complex mental health diagnosis, and his mother wanted to get the plan to cover a play therapy group that specialized for kids of his age. And we were successful with his appeal to get the plan to cover this treatment, in part because we worked all the way through all the steps of the appeal process and got to our external review. And we also could show from his medical records that he had tried a traditional talk therapy treatment for almost a year, but this treatment had not addressed his needs. And so the play therapy group was much more appropriate given his age. So if you face a denial where the plan has said that the treatment that you want is not covered under the plan, the first thing consumers should do is check their benefit handbook and be sure that's the case, and make sure that the benefit handbook kind of clearly states that that particular treatment is not covered or is excluded under the coverage terms of the plan. If the plan is saying that something is not covered because it's experimental or it's investigational, those kinds of denials can be appealed. And the most important step for that kind of appeal is almost always the last step, called an external review. And again, here you want to make sure you submit information in support of your appeal, and it probably would be a good idea to work with your providers to try to get any scientific information that they can help you find to show that that particular treatment is effective and there's a scientific basis to warrant trying that treatment for your condition. So I would also like to point out one important detail about consumer appeal rights under state and federal law. If the consumer is in an ongoing course of treatment, so for instance, they're in weekly mental health therapy or they're taking a prescription drug, if the health plan decides through some kind of concurrent review process to attempt to end coverage for that treatment, and the treatment's been approved previously and it's ongoing, then consumers have this very important right to require the health plan to continue covering the treatment while their internal appeal is pending. And so this can, for many consumers, lead to at least another month of treatment, but more importantly, it can also guarantee that their treatment isn't interrupted while they're starting the appeal process. And one aspect of this that's also important is that even if the consumer ultimately loses their appeal, they're not at financial risk. The plan has to cover the treatment that was ongoing and provided during their appeal, even if they lose. For example, if a patient were admitted to a hospital for inpatient treatment, and after a few days, the hospital, the health plan had decided they did not want to cover any further treatment, patients can appeal that kind of denial as well and ask for ongoing coverage pending their appeal. And if they're in a situation where they're at imminent risk of serious harm to themselves or others, if treatment is ended, they can also ask for ongoing coverage pending their external review appeal as well. So again, it's important to make sure you pursue all of your steps of your appeal, and also to work with your providers to request this ongoing coverage during the appeal process. And one final consumer right I'd like to mention is the consumer's rights under state or federal mental health parity laws, which require health plans to provide access to behavioral health benefits in a manner that's no more restrictive or limited than access to medical and surgical benefits under the plan. If you're facing a denial for behavioral health services or just administrative barriers to accessing behavioral health services, you should certainly raise mental health parity concerns with the plan, and also, if necessary, file a complaint with the applicable state division of insurance or the U.S. Department of Labor. Unfortunately, the timeline for resolving a complaint around parity can be very long. It can be an average of a year for the Department of Labor, for instance. So it won't be something that will give you a quick answer or response, unfortunately. But we think it's important to file these complaints so that over time, regulators pay closer attention to the health plans and any barriers they're imposing to access to behavioral health services. One of the most challenging aspects of pursuing your rights under the insurance appeal process is the time it takes, because each step of the process can leave you waiting 30 days or 45 days for an answer to that level of appeal. And it's really important just to remember to stick with the appeal process and follow it through. We also work sometimes with providers who've been through a couple of levels of appeal on their own on behalf of their patients, and they can also feel exhaustion from this process as well. But again, we just try to remind them that sometimes the most important step of the appeal process is the last step, the external review. So you have to stick with it and make sure you follow all the way through to the end. We've had so much success with the appeal process. We win, these cases for more than 3/4 of all of our clients when we find they have any kind of legal basis at all to challenge a denial. So it's very important to follow this through as much as you can.
Thank you, Wells. Now I'm going to try and just highlight a few things. Overall, about 50% of appeals are decided in favor of the consumer or the insured individual or family. Wells said that for his office, it's about 75%, which is great. But even 50%, the odds are pretty good, especially when you consider that often people do not take their appeals to the last appeal possibility, and they just accept that it's been denied. And as Wells said, it makes sense to just keep going until you exhaust all of your appeals possibilities. Here's a couple of things to highlight. Document everything, as we discussed. You want to document all of your calls and correspondence, and you want to keep all of your bills and notices. It helps a lot to keep your loved one's medical records current so that you don't have to scramble around and get bits of information as you're preparing to file an appeal. And you can also request that the insurer provide all of the records and notes related to their decision making in this particular issue. And finally, ask for your loved one's provider to support you all in making this appeal, because they were the ones who thought that the treatment was a good idea and prescribed it, and they should be advocating for that particular treatment to be provided. As Wells pointed out, you have the right to continued coverage and continuing treatment while your appeal is going forward. That's the legal right. But for the caregiver, it's just important that you continue to advocate for your loved one. You want to make sure that they're getting the care that meets their needs, and you don't want the appeals process to be something that causes them to backslide in their wellness efforts. So work with the provider to get the care that's best for your loved one. And if that one's not immediately available, what's a reasonable and hopefully temporary substitute? There are consumer assistance programs and similar agencies across the nation that can provide you with support for exercising your rights. Healthful Advocates is here in Massachusetts, but all over the country, there are programs that are available. In addition, if you are covered by a job-based health plan, you can contact the Employee Benefit Security Administration, which is part of the U.S. Department of Labor, and I've provided the URL and the phone number there.